Hi Dave, it's Dr. Buford. We're just getting started on the left shoulder. We're going to white balance in just a second here. Just taking our walk through the anatomy. Here's your biceps tendon. As we look down here, it's a little bit frayed but not detached, so that's a good thing. We're going to look towards the back of the shoulder. And as we look back here, posterior capsule looks good. The insertion to the humeral head looks good. I'm happy with the way that looks. I don't see any significant arthritis to worry about. Because of the magnification, even a little area like that, which is only a couple millimeters, looks like a big mountain, doesn't it? But it's really very small. Even so, we can still trim those areas and smooth those areas down, which we'll do in a minute. Here's the leading edge of the subscapularis tendon at the tip of the plastic cannula. And then here we see the anterior, inferior aspect of the shoulder, and it looks fine. Okay, so now we're looking at the rotator cuff, and on the articular side it looks good. We're going to look on the bursal side because often we find these tears start on the bursal side. The more common side is where we are here, but with what we're expecting for you, I think we're going to see it on the bursal side here. We're going to go off on the video and have a look at that in just a second. Okay, so here's the front of this bone spur. It's a pretty good sized bone spur. Okay. The width of this burr is about 4 millimeters in its outer diameter, so, or say 5. So we're taking off about 6 millimeters of bone here up to here. So now we use this as a cutting or a chopping block or as a template. You can see we're going to smooth it out up to this level here by taking away everything that's hanging down below. So once we have that established, it's very quick to do our decompression. We want to make sure we get all the way lateral as well. Hold the camera, please. Shaver. You guys can't put it in. Here's the tear in the tendon. We're going to place one suture anchor down. Why not RC, we call it. It's a triple loaded anchor. And just like we suspected, with bone spurs that big, you can see these bursal-sided tears right here. And so we're going to slowly unroof the tear, is the term we use, just to fully identify the extent of it. You can see as I lift up on it, hold the shaver just like that. I'm going to rotate the camera out, and as we lift up on it, you can see how that tear extends back through here. Getting back into some of this, you can see how the tendon's not healthy all the way back, which is why we typically repair these as full-thickness tears. That yellowish appearance of the tendon is not normal, not typical, I should say, of a healthy tendon. Just back to the joint line there. There. We're going to be placing a suture anchor in basically at this angle. There you can, that little hole you see in the middle, that's going all the way back into the joint. So we're going to place our suture anchor down right about here. See, we have a guide and we have an inserter that has an anchor attached to it. Now that we unload the inserter, we can remove it and we'll pull out the guide. And there's 3 sutures that we use to repair this tear. We seat the anchor by pulling back on it, and now, so now we're going to reach in with a crochet hook and take out one of these sutures on the left side of the spring, which is the front of your shoulder. So we're just having a look here. One of these two, I think the solid cannula. Okay, so there we go. There's a hook coming through for the first stitch. We'll retrieve that relay that you see there. Right hand. Okay, pause. Okay, so we passed 2 sutures. You can see the second was the blue and white striped one, which is back over here. And now we've got this black and white suture we're going to pass, which will be our final one. So we're going to hold the tendon reduced like this. We're going to come back and come in right about here. I want to be on the other side. Yeah, just like that. Pause. We're going to start tying sutures. We're going to start with this solid one. Hold this cannula. We're going to go ahead and tie a knot here.